The pandemic led to many canceled or postponed medical appointments, including preventive screenings. To learn about the importance of early detection through breast imaging, our producer Ashley Morin spoke with the co-director of the Breast Care Center at Beth Israel Deaconess Hospital, Needham, and a breast cancer survivor who's now cancer-free because she went in for her annual mammogram.
Why are women not getting their annual mammograms?
In the spring of 2020, when COVID really first hit us, we had to stop preventative care for obvious reasons. And so for some time, we were not offering screening studies to any patients. However, pretty much by June of 2020, we started providing preventative care and screening mammograms to all our patients. But again, everybody was worried and nobody wanted to go into the hospital unless they needed to go into the hospital, rightfully so, because people worried about COVID and getting COVID at the hospitals. We saw that many people postponed their screening exams, and not just for a year, but it was some of them have really not even returned to getting screening exams up until now, and we're 2 years into the pandemic.
Why is this concerning?
Typically, the American Cancer Society recommends mammogram screening every year because early cancers that are picked up, pretty much 99% will have a 5-year survival rate. So that means if your cancer is picked up early, the chance of surviving 5 years is almost more than 99%. But if the cancer is not picked up early, then obviously the chances of this go down. And when women don't show up for their mammogram for over 2 years, if there was a cancer that was growing, it's pretty much grown for over 2 years now. What we are seeing is that in 2020, we saw almost about 30 to 35% less cancer detection because that many people did not show up for mammograms. And now the cancer detection has increased about 1.5 times compared to what we normally see. So it's not because the number of cancers per year is increasing, it's just that many patients have not been detected. The cancer in that many patients has not been detected. And so unless women show up for their mammogram, we're not going to find those cancers early. And so that's very concerning.
Every month I would do my self-exam and I never felt anything. I've always had dense tissue. So when I go for my mammograms, they always ask for extra films as well as an ultrasound. So I didn't think anything of it. So when the radiologist came in and said, we found something, my heart dropped. And they did a biopsy and they found cancer, as well as there was cancer in one of my lymph nodes. So that made it stage 2. Do not cancel your mammogram. To me, not canceling it saved my life.
We've been taking all precautions ever since we started in June of 2020. The social distancing, everybody wears a mask. All the equipment is cleaned before we start a patient and in between patients. The time that the patients spend in the waiting rooms is minimized. Patients are called from the parking lot to come into the screening exam. Every staff member is vaccinated. So women should not be worried about getting into the hospital and getting all these preventative tests.
Is there anything else you'd like to tell Needham residents?
I would urge each one of you to schedule a mammogram if you haven't done so. If every woman after 40 should get a mammogram every year.
You should really do your yearly mammogram. It with the technology that they have nowadays, it saves lives, and it saved mine.